Beautiful sunny day again. Let me know when you're ready to roll.
Okay.
Got a good,
Making pictures.
good sound check and everything.
Yep.
Oh, good morning. So I think before we go into the time for grandparent story, I'm going to bring in the acting Chief Health Officer, give you a bit of an update. We'll take the COVID questions from him, and then we'll go into the story of the day. Where is it? Behind me.
Thank you, Minister. Afternoon, all. There are 18,678 cases today, and I'll talk about that in a minute because that is a data issue, not a cause for alarm. Overall, that means we have 55,581 cases of COVID, 109 flu cases for a total of 740, and 14 deaths in the last 24 hours. Last 24 hours reported. One of those in their 60s, 5 in their 70s, 2 in their 80s and 6 in their 90s. We know that 5 of those had not been vaccinated, had no doses. So it just re-emphasises that message, the importance of making sure people are current with their booster doses. And only 2 of those people, unfortunately, had all 4 doses that they're eligible for. No flu deaths in the last reporting period either. In hospital, 748 cases of COVID in public hospital, 27 of those in ICU, 15 non-ventilated and 12 ventilated. 113 cases of COVID in the private system, 3 in ICU, 2 non-ventilated and 1 ventilated, and 31 cases of flu in the public system, 3 in ICU, for a total of 892, which is good news, and it's reassuring that those numbers are starting to drop. So we're cautiously optimistic, but it's far too early to have anything more than that at the moment. We just ask people to keep doing what we've been asking so far, which is about getting that booster dose. It's so important, making sure you've got access to antivirals if you're eligible, and getting that test early, particularly within that 5-day period of symptoms. If you're symptomatic, stay home and wear a mask if you're out and about and can't physically distance. Just with those cases I mentioned before, it's really important that there's no cause for alarm there. This is just a data area with a backlog of data and retrospective backlog catch-up. Of the 18,678, 3,967 of those were rats, 14,711 were PCRs, but of those, there's only 746 that have been the last 24 hours. The other, approximately 14,000, is part of that catch-up, and that's just been due to a data issue with a number of the private laboratories catching up and reporting and talking through with those private labs. All of those cases have been notified as part of their normal procedures, and that's the important part. Those cases have all been identified, they've been notified, they've been able to access antivirals and isolate from the community. So really, we'll probably catch up with those. It goes back to the 10th of June, so it's probably averaging out over that period about 400 cases a day. So it's not something we would have really even noticed if it had been catch up as part of the normal period. But look, I'll stop there. Happy to take questions, but I think the message remains at the moment, as I said, vaccinations, antivirals, stay away if you're sick, and wear a mask if you can't distance.
How many cases in today's figures were actually from the past 24 hours, and how many
Of the, I'll give you that exactly, of the 14,711 PCR, 746 in the last 24 hours, the rest are all historical over that last month period.
So were those people notified that they were positive cases?
Absolutely. They were all notified by the laboratories as part of their normal process, and treating doctors were notified, the patients were notified, and this is just an issue with some of the pipeline with IT systems talking to each other, that's all.
So is this a software issue or an input issue?
We're working through that at the moment, but I think it's more a software issue that we're working through with providers.
We are seeing those hospital numbers starting to slowly come down. Do you think there's a chance we're over the worst of this winter wave?
Look, I think it's too early to say. Cautiously optimistic would be the phrase I'd use at the moment. We have a couple of days in a row where we've had our numbers drop, and hopefully that means that people are doing all those things we've talked about. And we know that since the announcement about access to booster doses, there's been that 3 to 4 times increase in booster dose uptake. We've had a 3-time increase in antiviral prescribing, so 3 to 4 time increase in antiviral prescribing. So people are doing those things, and hopefully we're starting to now see a change in the numbers as a result.
Is it possible that we've hit that peak already? I mean, the projected peak is still 3 weeks away.
Still too early to say. And I think the more, if we start relaxing and not doing all those things, that curve will turn around again. We've just got to keep doing this but it probably gives us confidence that we know the community is doing it, and we know we can change the shape of that curve and make that modelling roll and keep the numbers down in our hospitals.
Sorry, could we just get that graph again? A plane sort of ruined what you said there, sorry.
No, do you want to repeat the question? Or
Yeah, so I mean, is it possible that we've already hit the peak, even though it's modelled 3 weeks away?
Look, it's too early to say. I think it gives us confidence that the behaviours that people are exhibiting and going out and getting booster doses, getting antivirals and doing the physical distancing, wearing masks, they're all starting to work, but it's too early to have any confidence in that. And more importantly, if we relax and people stop doing those things, that curve will keep going up.
We've heard cases of patients having to stay overnight in the tents, the COVID tents at some of the hospitals. An example at the Redland, staying overnight. Is that best practice? Is that the best that we could do under the circumstances?
I can't comment on the individual circumstance. I'm not aware of that case, but what I can say is that I know all our hospitals, and again, you all know my background as an emergency physician, and the people who work in those emergency departments are doing everything they can to get people processed, get people access to care, and get them treated and either into hospital or home, and that's the best place for them.
Just Targi updated its advice on some smallpox vaccines that can be used for monkeypox this week, and have identified certain groups that it recommends vaccination for. When will those vaccines be available in Queensland?
At this stage, AHPPC is meeting this week to look at the guidelines and indications for eligibility and recommendations for vaccine access, and Queensland's working with the Commonwealth Government to look at procurement for the new vaccines. Remember, there's one international provider, and they do have a limited supply, so we're working with the Commonwealth. We have an MOU with the Commonwealth and an order in place for those vaccines when they are available to come into Australia and then Queensland.
Are we likely to see news on whether it undermines children's COVID vaccines being brought in as well around the same time?
Yeah, that's being worked through at the well as well. I haven't got the timing on that, when that will come through yet, and how that will be delivered. Again, supplies are limited for that as well, and the priority will be those children in particular who are especially vulnerable.
Have you heard when that Genius vaccine will actually arrive in the country? Because there is, GPs being asked about it.
I don't have any details on the exact arrival time on that one yet, and we'll continue to work with the Commonwealth and as soon as we know, and we'll work through the distribution process then. I'll step back. Thank you.
So we know in the last census that in Queensland we've seen a significant number of unpaid carers increase across the state. We know that out of those unpaid carers that around 1/4 of them are seniors or people over 65, or in nearly probably all cases grandparents. And we also know that with cost of living pressures and other pressures around workforce, that families are going to be turning to Nana and Pop a lot more now for assistance around unpaid childcare and other issues obviously around the house as people grapple with the kitchen table and the daily finances. A program that we have as a government, it's not a new program, but it's a program we want to emphasise in this current world, is that we have a program, it's just short of $1 million, called Time for Grandparents. It's a program that assists grandparents in how to actually manage doing unpaid childcare of children that they never thought they were probably going to have to look after in a modern world with technology and other things around them, and a world that has certainly changed since the day that they would have raised their children. So we have this program available. We have a hotline that people can ring and get advice, and there's some activities. And I'll bring Rhett Chapman, the coordinator of that program, forward now to explain some of the information about it, and then we'll take some questions.
Thank you, Minister. I manage the older persons program with Uniting Care Community. One of our programs is the Time for Grandparents. That program itself supports grandparents who are full-time carers or informal full-time carers of their grandchildren. What we try and do, we try to give them a bit of downtime, provide them some financial support if we can for their grandchildren's extracurricular activities, or if some grandparents would like to take some classes in something, we will try and financially support them as well. We also run what we call grand family camps every holidays. We'll have up to 80 grandchildren and grandparents attending 5 days of camps, which gives them an opportunity to connect and meet with other grandparents and grandchildren who are in a similar situation. We also do a lot of peer-to-peer support work. Grandparents have often said to us they would like to connect with other grandparents who have the same lived experience of having to raise grandchildren. So it's a fantastic program. It's been going for some time now. We really appreciate the money that goes towards supporting carers, grandparent carers, to raise their grandchildren.
How does the financial support work? So they're not actually being paid to look after kids to help them to pay for certain activities?
No, we often get requests for, one of the grandchildren might want to undertake some scouts or football lessons or swimming lessons, and we can contribute financially to help those grandparents meet those financial needs of those activities. But we also support the grandparents themselves who would like to do some activities as well. So we budget around that to make sure that we try and spread that load as even as we can.
So what sort of programs do you run? Like you mentioned there, the hotline. Like what would you be offering grandparents on those phone calls?
Well, often when grandparents call, they're just looking for some support, or they're looking to connect with other grandparents, or they're just generally trying to find out better ways that they might be able to undertake their caring role. So we'll look at those ideas of what they'd like to do. But one of the things that they do want is a bit of respite. So that's why we give them these opportunities to come to these camps. Often on these camps, you might get someone in that might sort of take them through some yoga classes or just relaxing, and we have full-time, on these camps, we often have youth workers who will provide recreational activities for the children, and the grandparents can just relax, sleep in a little bit, not having to cook, and that's often been what they've really, really valued.
How many grandparents have used the hotline?
We have grandparents who use the hotline. We've got about 400 grandparents at the moment on our books. Yeah.
Just a question for the Minister.
Okay, thank you. Thank you,
Yep.
Tar.
Righto. Shoot.
So just confirming this isn't a new program, but there's some extra funding that's been allocated to it?
That's right. We've increased the funding this year, obviously in line with most other funding streams. But the important thing being that, as I mentioned in the earlier stage, that every year there are new people, new grandparents that are now suddenly stepping into this role, something that they never ever thought last year that they would have to. So we just want to be able to re-emphasise it in this changing world around us at the moment, because there's probably grandparents out there that are watching this going, wow, I didn't even know that existed. That's me. They're talking about me.
What does almost $1 million of funding look like?
It's $961,000 and a few other bits and pieces.
Not so much money in the pocket though that people might be looking for.
Well, look, we have got a range of other incentives and concessions and rebates out there for seniors, and that's well publicised. We invest around over $400 million a year in those concessions for seniors and for others as well. And people need to ensure that they can tap into those. But as Red explained, this is around things like activities and advice and assistance and how to connect some of those things. If you're a grandparent now, you haven't raised your own children probably for 30 or 40 years potentially, and suddenly you've now got yourself a couple of teenagers that want to go and play footy or want to get into IT, and you mightn't have the faintest idea where to start.
So do they get a reimbursement, or do they sort of say they want to do a certain thing and get the cash given to them up front? How does it work?
It depends whether it's a financial issue that they're facing, or whether it's a connection issue. And as Red explained, they can help fund some of those things. But it all depends. It's individual based. So, for some people, they might actually have the funds, but they don't know who to talk to. They don't know where to go. They don't know how to make those connections. So they can start with that hotline. They can have a yarn to someone, and they can work it out from there. And it might just be that they just want to be able to talk to people who are like them. We all now live in gated suburbs and behind sort of, fences and things. We don't really know much about our neighbours or other people in our street.
As a seniors minister, are you concerned at the number of COVID cases that are still hitting the seniors in our community?
Look, we're watching it closely, and obviously it's obviously been a concern of government, since COVID came around. What I can say is I've actually been pretty impressed by the way that seniors have reacted and what they've done throughout COVID. You know, I know of seniors that, you know, they had to bunker themselves down, they had to change their whole habits. As we all know, cruise ships are predominantly full of over 65s quite often. So, you know, for them it was a big change of the way that they had to do life. You know, but they did a great job, and I think they really sort of led the way. But they've also had to pick up some of the pieces too, you know, with families and the changes to the family dynamic and everything like that. Nana and Pop are often the people that you lean to. So I think our seniors have done a great job, but they are vulnerable, and they know that they are vulnerable. They've often got more comorbidity issues. They know that they are vulnerable, and I think that's why when you walk through the shopping centres now, the majority of people you see wearing face masks are likely to be older Queenslanders.
Just quickly, have you been briefed on this terrible death of the 8-year-old boy in Rockhampton?
No, I haven't.
It looks like 2 people have been charged with murder. You haven't been briefed?
I'm not aware of that, no. All right.
Thank you.
Thanks, everyone.
Thanks.
Thank you.
Yeah, what's that one?